ask that you please mute yourselves throughout the entire 90 minutes. Thirdly, there will be a question and answer session following the presentation. We ask that all questions be submitted in the Teams chat feature once Dr. Eadie has concluded his presentation. We're hopeful that we can get all of the questions answered during the session, and apologize in advance if we're not able to get to yours. I will now turn it over to James Michel, CEO of Access Health CT.
Thank you, Margot, and welcome all to. This is the very first time we have teamed up with Dr. Eadie and Trinity Health of New England. With that said, with the intro from Margot, I'm going to turn it over to Dr. Eadie as we have a very lengthy 90 minutes of discussion to go through. Dr. Eadie.
Thank you, and let me say thank you to the entire Access Health team and your leadership, Mr. Michel, for engaging such an important conversation, or engaging residents in the state of Connecticut in such an important conversation. So I'm going to jump right in. I will speak rather quickly, only because I know we've got some special guests, and my most important and favorite part about such presentations is the Q&A. I think that's really when people get personal with their questions, get their questions answered and their concerns addressed. So why don't we jump right in here? Let me see what. All right, perfect. So I will engage you for probably about 30, 40 minutes. These are the topics I'm going to discuss. I won't go through them individually, but you see them in front of you. To the extent where I don't discuss them or cover them to your satisfaction, please drop the question or ask for a reiteration of any sort in the chat box. And of course, I was lucky enough or blessed enough to have received recognition from the Access Health team. And I just wanted to thank you all for the kind words. I shared it with my entire team, which was a large number of people. And we are going to emulate the way you guys did this. This was just amazing how you captured all of the positive remarks from the conversation we had previously. So thank you all with my heart for being so kind and receiving me as a speaker, and those kind words that was certainly uplifting during such anomalous times. So let's take a look at where we've been this year. So over the last 12 months, and in fact tomorrow, we are celebrating here at Trinity Health of New England. Well, I shouldn't say celebrating, but we are recognizing instead, I should say, the 1-year anniversary of the pandemic. To reflect, remember back in February in the state of Washington, there was just one confirmed case. Now, that's not to suggest that people didn't die from COVID in the month of January or December, which more than likely that is the case. But nonetheless, when we started looking for it as a healthcare system in this country, there was one confirmed death. And then, we had our first case here in Connecticut on the 8th of March, if I remember correctly. It was declared a pandemic on the 11th of March. And we went from one confirmed death, COVID-related death, to over 5,000, and it extended throughout all 50 states. So that's just to reflect on that for just a moment. And then we peaked in to the fourth week of April at 60,000 cases. And we thought that really was a lot, but we had no idea what we had coming. And so we sort of bent the curve. We flattened the curve, as you see in front of you. And then we, as predicted in October, because of Halloween, we're pretty sure and comfortable forecasting that we thought that things were going to get worse. And then in November, because of Thanksgiving, we were pretty sure that people were going to gather, although they were advised not to around Thanksgiving. Then December was Christmas. December was Kwanzaa. December were a number of other holidays like Hanukkah. And then we had New Year's Eve. That was a big celebration. So you see those 3 months of celebration, and you see those 3 months of an increased rate in deaths per month as well. And then we ended the year, then there was Three Kings Day, of course, but we ended the year on record as having the most deadly year ever experienced in this country. And then, of course, in January, that was the most deadly month that we'd ever seen in this country. And as a physician, we're all taught as clinicians that the 3 common causes of death, which Access Health knows very well, being heart disease, stroke, and cancer, but not since this pandemic started. The number 1 cause of death, unfortunately, now is the coronavirus. So we've seen a lot, we've been through a lot, and it's just through the grace of God that we're all here participating in this educational session today. Listen, I have been rather controversial with my position on the so-called vaccine hesitancy. So I thought I would add a slide just to cover that, because I want you all to know, when you see and hear me publicly saying that I do not believe that such vulnerable communities in the state of Connecticut or across the country suffer from vaccine hesitancy. It didn't sit well for me initially because the United States said that these vulnerable communities were hesitant even well before the vaccine was even presented to the FDA for approval. So that was pretty odd, because how dare we suggest that people, and in my mind, you're blaming these highly vulnerable communities. This is my opinion. Let me underscore that. But I thought it would be important to look at the definition of vaccine hesitancy. And I'm encouraging people to eliminate vaccine hesitancy, or the word vaccine hesitancy, from your vocabulary. And here's why I suggest that. There's three components to the definition. First, vaccine hesitancy it refers to a delay in acceptance or refusal of vaccines despite, and I'm underscoring despite, the availability of vaccine services. That is not the problem that I am seeing here in Connecticut. It is not that people are not willing to roll up their sleeves and get vaccinated. They just want to know more about the virus, and they just want to know more about the vaccine. So again, another high five to Access Health, because they're providing this information to their colleagues and to the community at large. But it's the inability to access vaccine, just like it's the inability to access, in many vulnerable communities, a provider who understands you and your culture, or access a hospital, or even access a primary care physician, or accessing healthcare insurance. Access is the problem, not vaccine hesitancy. I want to know more about the vaccine. Does not equal hesitancy. Here's a second component of the definition, that it's a complex, yes it is, and context specific, varying across time, place, and vaccines. That doesn't apply to the feedback and the experience that I'm having done probably north of 50 of these conversations in the state of Connecticut alone. And then third, and most disturbing to me, is that this so-called vaccination hesitancy that exists in these highly vulnerable communities is influenced by factors such as complacency. Look, I am never going to allow anyone to say that these vulnerable populations are complacent with the number of deaths that occur in their respective communities. No one's happy or complacent or satisfied seeing their loved ones and their friends die every single day. Remember, we got up to almost 4,000 deaths a day in this country. And the vulnerable communities, I think they're misrepresented when we suggest that they're complacent. Convenience, now that's a problem, because having a convenient way to access the vaccine or a convenient way to access education is a problem. And again, we're trying to mitigate as much as that is possible. So that's really the only component about this entire definition. This is not Eadie's definition. This is the World Health Organization's definition. So it's the definition every time we use it. So again, let's use it with caution, and let's not point the finger at vulnerable communities as if it's their fault that they are not going to be vaccinated, because it's not their fault. It's our fault, because we need to do a better job in getting the vaccine to the community and educating the communities the way they want to be educated, not the way we think they should be educated. And then the last component is confidence. Now, listen, there is some mistrust or untrust around the healthcare industry for vulnerable communities, particularly these communities of color, and there's a reason to be. So let me start by saying that we don't lack confidence in the vaccines. We don't not believe that the vaccines don't work, especially after participating in such a conversation. I realize this is emotional. This is my soapbox. You probably did not tune in for that. But I beseech you to consider the definition. Just do a Google search and understand the definition of vaccination hesitancy before you claim that a group of people based on their ethnicity or their race or their socioeconomic status is hesitant. Because by this definition, the people that I've been talking to are not hesitant. They just want their concerns addressed. They want their questions answered, and they want equity in vaccine distribution. They want access to the vaccine, and that is not vaccine hesitancy. All right, so let's talk about herd immunity. I'm sorry about that, but I just wanted to be clear, because I'm getting emails and letters, and when I'm out in public, people are saying, I don't agree with you in your position of vaccine hesitancy. And that's fine. You don't have to agree with it. But I thought it was my obligation to share with you all why I don't think that vaccine hesitancy has ever been a problem or is a problem currently in the state of Connecticut in these such vulnerable communities. And I'm going by the definition. And I'm being emotional about it because I think that my understanding, interpretation of the definition happens to be right, at least in my mind, but that's my opinion. The definition of herd immunity is not my opinion. Let's talk about that. So herd immunity is the ultimate goal here. The reason why we're having these conversations, we're not trying to twist arms and talk people and get them vaccinated, but instead we're trying to arm you with the knowledge so that you can make an intelligent or well-informed decision as to what's best for you and your family. But the ultimate goal here, in order for us to remove our masks, no longer social distance the way we're doing, is to reach herd immunity. So Dr. Fauci started off during the first wave talking about herd immunity, and he thought that about 70% of the population needs to be immune. And that's when we can then comfortably remove our masks. Now that number is about 80 to 85%, depending upon the source that you're experiencing. But herd immunity means this. It's the majority of the people, again, let's say 70 to 85%. I like to say 80% of the people have an immunity to the coronavirus. Now you see at the bottom, there's two ways to establish immunity, either through exposure, which when you have thousands of people dying every single day, not like 5,000 people in the month of March or one person in the month of February. We're talking about every single day, thousands of people are dying. And I'm sure everyone on this participating in this virtual conversation knows someone directly or indirectly who has unfortunately succumbed to the virus. That's one way to reach it. That will probably take 5 years, is my estimation, to get there. And so do the math of how many people will die, which will include some of us participating in this virtual meeting today, if we waited that long. The only other way to reach herd immunity is through vaccination. And that's why I volunteer my time to talk to as many people. It can be one, it can be 1,000, to at least share my experiences and the intelligence that I know and the interpretation of the science that I have on why it's important. Why it's important for us to reach herd immunity, not necessarily why it's important for you to get vaccinated. My prayer, though, is by the end of this conversation, you will make your decision to do so, and it will be in favor of us reaching herd immunity. So another concern that people have is the fact that this vaccine was produced in such a short period of time. So let's talk about just a couple of numbers. I'm not going to go through this busy slide, but I just want to draw your attention to the red circle. So you see the top horizontal line is the typical process. So this is the typical process it takes in the United States of America for a vaccine to be produced and then approved by the Federal Drug Administration. We're talking about, in this case, emergency use authorization. So it takes about 6 months or 73 months on average. Now that's probably, I'm guessing, how long it'll take if we passively or through exposure reach herd immunity. And listen, we don't have 5 years or 6 years or 73 months. We can't afford that because too many people are dying every single day. So when the charge came for these manufacturers, we're talking specifically about Pfizer, Moderna, and now Johnson & Johnson. When the charge came for them to quickly produce a vaccine, they were only able to do so for a couple of reasons, and I wanted to just share those with you. So a couple take-home points on how they were able to produce the vaccine so quickly. So in the typical process, which takes about 73 months on average, and to put things in perspective, the influenza vaccine, the flu vaccine, took almost 10 years to produce. So the typical process is done in series, so step by step, right? So in sequence. So you couldn't go to step 2 until step 1 was done, step 3 until step 2 was done, and so on and so on and so on. That is why it takes so long. Now, because of something called an RNA technology, which we're going to talk about in just a second, let's go down to the accelerated process. They took this technology that existed for probably almost 10 years. They stopped the line in which they were using it for to come up with a vaccine and a cure for cancer. And they decided, you know what, let's try to focus in the midst of a pandemic on creating very quickly a vaccine. And so the difference is, one, they had the RNA technology. We'll talk about that in a second. The second difference is that they didn't do things in stepwise fashion, right? They did things in what I call parallel. So in other words, they did step 1 and step 2 at the same time, parallel. They did step 3 and step 4 at the same time, simultaneously in parallel. And that's how they were able to reduce it significantly to the target at that time was 14 months. But you and I both know that we're just going to be acknowledging or recognizing a year of the pandemic on tomorrow. And we had the vaccine, the first vaccine available in December. So they clearly beat their target deadline by having it in a much shorter period of time. It was produced in the same year that the pandemic started. So the point here is that They were able to produce it only because they took some RNA technology that already existed and brought it into the laboratory and focused on a vaccine for the pandemic or against the coronavirus. They did not jeopardize, I need you to hear this, quality, safety, efficacy, nor did they skip any steps. And so that's why I am comfortable having this conversation with you today. Wanted to put that at rest for you as well. So I want to quickly go through what I call my IKEA analogy. The purpose of this analogy is to use an IKEA analogy to introduce what DNA is, introduce what RNA is. Therefore, we can talk about how the virus works, and then we can talk about how the vaccines work. So imagine my wife, Kimberly, sent me to IKEA to purchase a table and 8 chairs. So she took a picture of it. She texted it to me. She sent me to IKEA on a Saturday morning with the honey-do list. I then, if you've been to IKEA before, I got the big long cart. I rolled the cart down the aisle where the boxes are. I identified the table based on the picture she had texted me. And then I loaded the box onto my cart. I'm making my way up to the register to pay for the box. And then because the line, which is usually long at IKEA, was long in this analogy, I decided to open up the box. It's just the Virgo in me, and peruse the instruction manual. So I did that. And by the time I got to the register, I said to the man or woman at the register, there's no way in heck I'm going to be able to put this together. I'm just not the handyman. So in addition to paying for the product, can I also pay for assembly? They happen to say, yes, we do have an assembler. So let's call this person an assembler in the back of the store who, for a fee, can put together your table and 8 chairs. So I paid for that, and they took my cart to the back of the store for the assembler to assemble it. This red circle represents all activities that take place inside of IKEA, right? So keep that in mind. Red circle inside of IKEA, which is important. We'll talk about in just a second what happens inside of your human cells. But for this analogy, realize that once the assembler completes assembling the table and chairs, then I then must take the assembled table and chair outside of IKEA, load it up on my vehicle. So now I'm outside of the circle, and then take it home so that we can utilize it. So hopefully you understood that analogy. So let's move on. And this is the same analogy. It just looks a bit different. So the circle is inside of IKEA. The box is the first arrow, which has the instruction manual, the parts and the tools. The second arrow is when my cart with the box went to the assembler opens up the box, and what does he or she see? The instruction manual. They see the parts. They see the tools that comes with the box, and then they do their work. So realizing that the box does absolutely nothing. It just houses information. The assembler takes the housed information in the box, and they decode, if you will, interpret the instructions there, and then they assemble it, and then they roll that back up to the front of the store. I exit IKEA, or the red circle in this analogy, load it up and take it home. So now let's imagine this red circle is not IKEA anymore. Let's imagine it's one of the million cells that you have inside of your body, right? Okay, so remember, you've got the box that houses the information. You have the assembler who does the work based on the box or the information. And then you've got the red circle, which is your human cell. And then outside of the human cell is the assembled table and chairs that I now take home. All right, so if you got that, let's change up just a little bit. We're not going to get too scientific, but I just want to make sure that you all understand what DNA is, what RNA is, and then you will understand, if I do this correctly, how the virus works and how the vaccine works. All right, so now let's replace the box, right, which houses the code, which houses the information. It's a package of information, and let's replace that with DNA, because that's what DNA is. You get half of the information from your mother, half of the information from your father, and it sits inside of your cells, inside of your nucleus, and that's your DNA. That's what's unique to you, unless of course you have the egg, and the egg was fertilized and then split into two, and you have identical twins in your family. You too will have the same DNA as well. But nonetheless, you have half of the DNA from your mom, half the DNA from your dad, and that's equivalent to the box in the analogy for IKEA. That's where all the information, everything you need. But the box in of itself does not do the work, right? It's the assembler. So the assembler is RNA. That's what RNA does. RNA reads the genetic code, if you will, and then, which is the instruction manual that you got half from your mom, half from your dad. And it goes to work to produce whatever the genetic code tells it to produce. It can produce cells for your skin, cells for your liver. It is the reason why your skin's the color it is, your eyes are the color they are. If you have hair, unlike me, how your hair is replaced over time. And it also has a code in there to tell it when the hair will turn gray. So all that is built into the coding and the instruction manual inside of your cell. And then, so that's what DNA does. It houses it's like the box, it houses the information. The RNA does the work. And then the final product, so now that's your cell, the final product that RNA has produced is released into your bloodstream. So that's what DNA is, that's what RNA is, and that's how it works inside your body. Draw your attention to the top right corner of your slide, and you see there's a unilateral or one-way flow of information and activity. DNA is the genetic code. The RNA interprets it and does some activity, and in this case, it produces the protein, and then it puts the protein wherever it's supposed to be, sometimes in your blood, whatever the case may be. But the point here is that if there were arrows that can go in the opposite direction, I would have simply put arrows going from protein to RNA and RNA to DNA. But that's not the case. That's not how the creator made it to work. So when people say that when you get this RNA-based vaccine, which will make sense in just a second, that it can alter your DNA, that is not true, because RNA never goes in reverse into your nucleus and interacts with your DNA. So it will not alter your DNA. Just wanted to add that there. I'll be debunking, if you will, or providing some degree of hallucination to the narratives that are out there in particular. All right, so now let's talk about how the coronavirus works, right? This excites me, so bear with my level of excitement here. So top left corner of your slide, you've seen that illustration multiple times. It is an illustration of the coronavirus, and it's sort of what it looks like microscopically when you look into a microscope. And if you stain it with color, and particularly red, this is kind of what it looks like. The point here is that there's two components of the coronavirus that we're going to talk about for the remaining of the conversation. One are those protrusions on the circle called spike proteins, right? So I like to refer to them, just to make it simple for me to explain it to you, which is my job if I do this correctly. And I like to refer to it as an arm and a hand. An arm and a hand. It kind of looks like an arm and a hand because it kind of looks like this, right? So that's what the spike protein does. And it'll make sense as to why I call it arm and hand in just a second. And then look at that white squiggly line on the inside of the coronavirus. So they simply opened up 25% of the coronavirus. You can take a peek on the inside. They're not showing you the DNA, so don't worry about that. But that's the RNA. The RNA, remember, reads the DNA, and then the RNA does the work to produce whatever it has been instructed to do. In this case, the DNA of the coronavirus tells the RNA to produce an entire new coronavirus. From nuts to bolts, the entire circle with all of the protrusions or spike proteins or arm and hands and everything else that makes up a coronavirus. So that whole squiggly line is an important part to how the coronavirus infects you as a human. All right, so let's talk about what it does. So the coronavirus, the arm and the hand, they have a primary function of doing just this. That is that the coronavirus, the hands of the arm and hand, the spike protein, literally grabs onto one of your human cells. The hands punch holes into your human cells for one reason only, and that is to deposit its entire RNA into one of your cells. So when it deposits an entire RNA into one of your cells, you know exactly what's going to happen, right? The RNA of the coronavirus, once it punches holes, is going to deposit its RNA, complete RNA, and that's important for me to underscore right now, the entire RNA. And what does it do? It produces another coronavirus. So that's why you go from one coronavirus, once you inhale it or ingest it, to 2, and then to 4, to 8, to 16, to 32, and so on and so on. And if that number grows to the extent where it impacts the nerves that are responsible for your smell, you lose your smell. Your taste, you lose your taste. In your lungs, it creates your inability to bring in oxygen and blow out carbon dioxide. And those are people who get in trouble. They need to be hospitalized or placed on a ventilator. And unfortunately, thousands of them die every single day because this is a very aggressive virus. So let me give a quick analogy to sort of put this in perspective before I go to the next slide. So let's say, Mr. Jones, proverbial Mr. Jones, came into a building got on an elevator alone, went up to the 3rd floor, and before Mr. Jones got off of the elevator, let's imagine that Mr. Jones took his mask off for one reason or another. And when he took his mask off, because no one was looking and he doesn't like to wear a mask, let's just pretend that's the case, Mr. Jones was positive for COVID-19 or the coronavirus. And so what Mr. Jones did is he released this microscopic virus in the air. And we know now that when you release the virus in the air, if it's just through normal breathing or talking, it can go at least 6 feet away. And that's why social distancing is 6 feet. But it's important for you to know that if someone is singing or has a pressured speech like I'm doing now as I orate, that I can push it further than 6 feet. So just keep in mind that 6 feet social distancing is the minimum amount. All right, so Mr. Jones, his elevator lands on the 3rd floor, the doors open, he puts his mask back on, and he exits the elevator. Now, microscopically, there's coronaviruses floating in the air, and they will float in the air until some period of time when gravity brings them down, and they will eventually die. The only time a coronavirus can stay alive is if it has access to a human cell, punches holes in the cell, deposits its entire RNA, and now it begins to reproduce and has a family. So coronaviruses, just like humans, want to have families, and they want to reproduce. They want to survive. They want to last forever, which is also why they mutate, by the way. But we'll get to that in just a second. So Mr. Jones is off the elevator. The elevator now is filled in the air with coronavirus. So let's say Mrs. Smith comes into the building. Mrs. Smith is going to the 5th floor. She calls the elevator. It comes down, door opens. She gets on the elevator. Now, for whatever reason, let's say Mrs. Smith also does not like to wear a mask. So Mrs. Smith just takes her mask off. No one's on the elevator, so no one's going to give her this weird look, and no one's going to hold her accountable for not wearing her mask in this analogy. But what she doesn't know is that Mr. Jones just got off and deposited coronavirus in the air. Her mask is off. She inhales, whether she breathes through her nose or her mouth. We do both of those, mostly through our nose. And now we're talking about how the majority of people get infected by the coronavirus. Her mask is off. She is inhaling, and she is inhaling a coronavirus that will do what? Grab onto her cells, punch holes, and deposit the entire coronavirus RNA. And then she gets to the 5th floor. She puts her mask back on. She exits the elevator. And now, although it has already been going on in Mr. Jones's body, Mrs. Smith is now, she had no idea that the coronaviruses are grabbing onto her cells, punching holes, and depositing the RNA. So she now has been infected. So that's very important. Now you understand how the coronavirus works. Now let's talk about how the vaccine works, how we combat the coronavirus activity that I just described, how we create immunity amongst ourselves, amongst our communities, amongst our families, amongst our cities and counties and states, and then how we get to, at that 80% number, whatever the right number is, herd immunity, so we no longer have to worry about the coronavirus. We can demask permanently, we can not social distance permanently, and get back to whatever the new normal is going to be. So remember when I talked about the timeline on how they were able to produce the vaccine so quickly. I talked about an RNA technology that existed. So let's go back to that. So they stopped using RNA for cancer services, and then they shifted to laboratories like Moderna and Pfizer and Johnson & Johnson and AstraZeneca. And they said, how do we take this technology, which I'm about to go through quickly, and create a vaccine? So they took the first thing they did was they removed the coronaviruses from human beings, took it to the laboratory, they opened it up, and then they were able to pull out the spike protein, the portion of the entire coronavirus messenger RNA, and they isolated only down to the part of the RNA that's responsible for producing the spike protein. Let me say that again. So remember that white squiggly line. That entire white squiggly line, when the coronavirus and puts it in one of your cells, produces an entire coronavirus. In the laboratory, because this new technology allowed them to take the whole strand of RNA and then find out what part is responsible for the outer shell, the inner shell, the DNA, and they got to the part that's responsible for the RNA, the RNA portion that's responsible for the spike protein, and that's what they focused on. The reason why is because it is the spike protein that is the first step by which it infects a human cell. because it starts off by grabbing one of your human cells and punching holes so that it can parse the RNA. So they focused only on the part of the COVID's RNA that's responsible for producing the spike protein. So that's the entire. They reduced it down only to the part that's responsible for producing the spike protein, and that's what's injected into the human being. So once they inject only a part of the, and I got to keep saying this to make sure you get it, because people say you get coronavirus from the vaccine. If we inject, if the vaccinator injected the entire RNA of the coronavirus into your muscle, then you would start producing entire coronaviruses, which you'll get coronavirus from. But they only inject a part of the RNA that's responsible for the spike protein, the arm and the fist. So that's all they're injecting inside of you when you get vaccinated. So therefore, it's still RNA. So you know what RNA is going to do. It is the activity. It's the assembler. It's the part that is going to make just the spike protein. So your body produces spike proteins. Once your body produces spike proteins, then you make antibodies to the spike proteins. And as you make antibodies to the spike protein, you then develop an immunity. Let's go back to the elevator analogy very quickly, and then I'll move on to the next slide. So if Mr. Jones had been vaccinated, when he got on the elevator, completely vaccinated, meaning he had 2 shots if he had Moderna or Pfizer, and he had 1 shot if he had Johnson & Johnson, and he waited, by the way, 14 days after his vaccine. If he would have taken his mask off after after Mrs. Smith, I'm getting the names mixed up, after Mrs. Smith had put the virus into the air, when Mr. Jones got on and took his mask off, when he inhaled the coronaviruses, when the virus went to go to one of his cells to grab onto a punch holes and deposit the RNA, his antibodies would have stopped it from attaching to the cell and punching holes. And that's equivalent to immunity. And that's why the vaccinations are so important, because now you heard the CDC this week say, if you've been completely vaccinated, you can go without a mask and not social distance around other people who've been vaccinated. Or if you're a grandmother who's been vaccinated, you've not spent time with your grandkids since the pandemic started. If you've been completely vaccinated, you can then go into the home of your grandkid and spend time with your grandkid. So this is a new day, and this is what the vaccine does for us. These are the benefits that the vaccine provides to us. Now, there are risks, and I'm going to talk about those in the form of side effects in just a second, but because I've got to balance and be transparent and balance the conversation out for you. But nonetheless, these are the benefits of the vaccine. So now if you understand how the virus works, particularly the spike protein, and you understand how the spike protein is the first step in infecting one of your cells, and then now you understand how the research, because of the messenger RNA being able to isolate one particular part of an RNA, regardless if it's man or a virus, now you know how the vaccine works. Let's talk about the 3 vaccines that we have here in Connecticut. For slide orientation purposes, let's look at the purple box. The first line on the purple box are the manufacturers of each of the vaccines. The first column of the purple box are the characteristics of the vaccines. And then we'll look vertically at each of those 3 vaccines. I won't talk about AstraZeneca because that's not available at this time in our state. So Pfizer. Now you know exactly when you read or hear, when you're watching whatever news stations you watch, when they use this terminology, God willing, you now completely understand it. So Pfizer is an RNA base. You got that. You get 2 injections, 21 days apart. The efficacy. Now remember, if the efficacy was impacted, if the quality was impacted, if the safety was impacted when they in an accelerated manner were able to produce the vaccine in that short period of time, these numbers and this conversation will be totally different. But it's because they did not skip a step or negatively impact quality, safety, or efficacy. I say with security that the efficacy of Pfizer is 95%, which means, remember, per cent means per 100, cent 100. It's 100 pennies in a dollar, so per cent. 95 out of 100 people have immunity once they're injected by Pfizer. 94 or 95 if you round it up, because it's 94.5, I think. Moderna injected humans have pure immunity to the coronavirus. And if you look compared to Pfizer and Moderna, there's really only one difference between the two, right? Really 2. One, Pfizer takes a lower temperature to freeze, Moderna not as low. So Pfizer has to have a special freezer. Moderna just needs a regular freezer. And then Moderna is 2 shots 28 days apart. Pfizer's 2 shots 21 days apart. And that's about it. They essentially are the same vaccine nonetheless. And then there's Johnson & Johnson. Now, Johnson & Johnson is a little different. Before I talk about that quickly, let me drop down to the green box, please. So draw your attention to the green box. You see the flu vaccine, and you see the measles, mumps, and rubella vaccine, sorry. So the flu vaccine is an actual, so I got the flu vaccine. I get it every single year during the flu season. I usually get it around September. Flu season starts about October, and it lasts till about February or March. And so it's an annual once-a-year vaccine. The reason why it's an annual once-a-year vaccine, I get this, is because once you're vaccinated, you produce antibodies to it, but then the antibodies begin to decrease in number in your bloodstream until they go back to 0. And then, when flu season comes back again, you get another booster, and then you get the vaccine, you get the immunity to the flu virus during the flu season. So again, I kind of look at it as a clock. So it's like from the 9 o'clock to the 2 o'clock, and that's flu season, right? From the 9th month to the 2nd or 3rd month is the flu season. So that's around the time when we see a lot of flu coming into, I'm an ER doctor, into emergency departments, and that's why it's important there. But what I want to underscore is that both the flu and measles, mumps, and rubella, they actually take the virus. They weaken or deaden the virus, and then they inject the virus into you, which is almost like injecting the RNA that's only for the spike protein, because the virus can't make you sick, but nonetheless, your body responds to it and you create an immunity to it. So let's go back up to Johnson & Johnson. I'm going to move to the next slide and speed up just a little bit for the remainder of the slides. I just wanted to touch on these important points. So the difference between Pfizer, Moderna, Johnson & Johnson, and AstraZeneca is I bucket Pfizer, Moderna into one bucket, Johnson & Johnson into another, because they all use messenger RNA, as you see the vaccine technology line, the second line on the purple box. But Johnson & Johnson and AstraZeneca actually use a virus, and they use the virus as what's called in science as a vector, meaning that instead of just injecting a piece of the coronavirus RNA into the human cell, a muscle cell, they instead put it into a virus. And in this case, it's called the adenovirus. The adenovirus is what causes the common cold. It's been deactivated or inactivated or attenuated, whatever terminology you're comfortable with, but so you won't get a cold from the vaccine. But worst case scenario, that's the worst you'll get, but you won't because they deactivate it. So they take this vector, the adenovirus, the common cold virus, they add the RNA to it, and then they inject that into you. So that's really the only difference from a technology perspective. Now, of course, Johnson & Johnson is one injection. Now, let me just talk about very quickly the efficacy. Remember, the efficacy for Pfizer and Moderna is about 95%. So 95 out of 100 people don't have to worry about anything. For Johnson & Johnson, you see on the screen that it's about 72 to 85%. So one may say that Johnson & Johnson is inferior. But let me tell you why it's not inferior. Remember, I talked about, like humans, viruses, they want to survive and last forever. So just like humans, they adapt to the environment. So when the virus understands that you have a vaccine out there, then it's going to start adjusting itself, and the adjustments, the mutations, the variants actually takes place in the arm and hand and the spike protein. But what you just need to know is that the only reason why that number is lower is because the UK and South African variants was tested against Johnson & Johnson. They were not tested against Pfizer and Moderna. Why? Because they didn't exist back then. So Johnson & Johnson had to go up against the regular coronavirus as well as the UK mutation and the South African mutation, which are much different than the regular coronavirus. And so that lowers its efficacy down. Remember, Dr. Fauci said that we just had a vaccine that had an efficacy of 50%. He was talking about the flu vaccine, by the way, we'll be just fine. It's still much greater than 50%, and still a great vaccine. Now, what I will tell you before I move to the next slide is that if we put Pfizer and Moderna up against the UK variant and the South African variant, that number is going to drop down to about 85% as well. So if we did that, we are then comparing apples to apples. But right now, we're comparing apples, Pfizer and Moderna, to, let's say, oranges, Johnson & Johnson. So hopefully that all makes sense. If I could do it all over again, meaning if on December 21st, when I got my first vaccine, if Johnson & Johnson was available, I would have taken Johnson & Johnson because it's only one injection. I wouldn't have to worry about coming back again. The side effects we're going to talk about in just a second, I wouldn't have to worry about those as well. And listen, it stands up against the mutations or the variants as well. The most important point to take home about Pfizer, Moderna, and Johnson & Johnson is that regardless of which one you decide to take, when you're vaccinated, you don't have to worry about getting so sick that you'll need to be hospitalized, and you also don't have to worry about dying from the coronavirus. And to me, that in and of itself was enough for me to roll my sleeve up and get vaccinated. I thought I'd just show a comparison between the three. I think the last time we talked, I only had 2 boxes, maybe just 1 box, I can't recall. But pay attention to the red highlights. So, and I'll just mention them. So, oftentimes communities of color ask me, well, those clinical trials, was there anybody in the trial everybody wants to know if there's anybody in the trial that's like me, whether it's your ethnicity, whether it's your comorbidity, so people who have had cancer or have cancer, people who are immunocompromised or have a weakened immune system, people who are obese or overweight or are diabetic. And they did. They included all those people in the research. But I wanted to just provide some degree of security for the Latinx and the African American communities, because you remember, you see at the bottom of the slide, there's usually a 5% difference in comparison in population size in our state and across the country for African Americans and people from the Latinx community. So in Connecticut, about 10% of the state is African American, about 15% is Latinx. And then when you look at all 3 of those, you see Pfizer had 10%, so that's a great representation. African American, 13% Latinx. And you see Moderna and Pfizer did a great job in representation as well. So I just wanted to dispel that there's a narrative out there that says that there were not enough or not any African Americans or people from the Latinx community who were involved in clinical research, or we're not really sure how it will impact us. So we've done, I don't know, north of 50, probably 75 of these talks since the vaccines have been available. So we do them almost every night. So if I look extremely tired, it's because I am, because we do this all the time. But listen, I would much rather spend time doing this than a lot of other things, which I would probably do nothing if I was at home right now. This is more important, and this is how we save lives, create a herd immunity, and get ourselves out of this pandemic. So I'm not just talking the talk, I'm walking the walk. This is a picture of evidence of me getting my first injection of Pfizer on the 21st, and then 21 days later, the president of St. Francis, who happens to be a licensed pharmacist, so he took the class to give injections. I was his very first injection, believe it or not, which I trust him. He's my teammate, so he gave me my second shot, and I'm doing just fine. I wanted to talk quickly about what we're doing in the state, just because people often ask. So remember, on March 1st, we decided to not go about comorbidities, because one of the reasons why, just so you know, why I supported the comorbidities is because if we did the comorbidity route, which we were going to do initially, and you probably heard me say that's the way we were going to go, but we rethought that thing. We timelined it. We saw that if we went the comorbidity route, not only would it be difficult to operationalize or implement, because how do you choose a type 2 diabetic and not a type 1 diabetic, for example? If we say grocery store workers, is that someone who works in a small market or a large market? So all that was very confusing to us. Plus, again, it would be several months before we opened it up to the general population. Going by age, because 95% of the deaths we've had in Connecticut were people who are 55 and above. So we figured, let's get to 55 as quickly as possible, which is why we dropped it down to 55 on the 1st of March. You see there on the 22nd of March. So 3 weeks later, only 3 weeks. 3 weeks later, and today's what, the 10th? So we'll be there in just a second. We drop it down to 45. 3 weeks after that, on April 3rd, we drop it down to 35. And then 3 weeks after that, on May 3rd, we open it up to everyone who has been approved. And remember, that's 16 years old and above, until we get approval from the FDA for younger ages. They have to go back and ask the FDA for approval of each of those manufacturers. So by May 3rd, instead of June or July, it'll be open to the general public, and we can get to herd immunity, assuming 80% of us roll up our sleeves, much sooner than we anticipated. So I believe this is the right way to go. It doesn't make everyone happy, but I think it saves more lives than not. Side effects. So let's talk about these. This is the downside of the vaccine. Just got to be transparent. Those are the second type of side effects: pain or swelling, fever, headache, nausea, vomiting, chills, joint pain, and muscle pain. There's one more missing from there, and that's adenopathy, or swollen lymph nodes under the axillary or underarms, which really is just a little bit of soreness, but it becomes, to the female participants in today's conversation, it becomes a problem, because think about this. When you go and get a mammogram, and if you've had recently the vaccine and you have swollen lymph nodes under your underarms, that could be a sign of breast cancer, right? And so it could sort of skew, if you will, the interpretation of your mammogram. But thank God there are some very smart people out there who can tell the difference. But nonetheless, you got to make sure that you give that history and make sure they ask that history. And I'm pretty comfortable that the hospital, I'm not comfortable, but I know, because I've asked, that our experts at St. Francis and our other Trinity Health New England hospitals are very educated and very well aware of how to delineate between the two. So those are really the 8 side effects that we can expect. Let me start by saying this. You want side effects, but why do you want side effects, Eadie? Who in the world wants side effects? Side effects mean that after your first or second injection, you're creating an immunity to the virus. And so you want a sign that you're creating immunity. Now, unfortunately, people 55 and older don't necessarily get side effects. People 54 and younger will get side effects. One of my teammates, who's our chief clinical officer, was about 44 years old, some ridiculously young age in comparison to me and others. He had flu-like symptoms the next day, but on the third day, he was back up and his jovial self and back at work. The good news is that, one, not only do you want side effects, they only last for no more than 24 hours. So if you're concerned about missing work, or you can't afford to miss work, or don't want to miss work, I'm one of those people, then get it on a Friday afternoon, because worst case scenario, you'll be down on Saturday, but you'll be back up to go to your place of worship on Sunday, and you won't miss a day of work. Because it usually happens, the side effects happen several hours after you get your injection. Now, your second injection, from a side effects perspective, expected to be worse than your first. And here's why. Because after your first injection, you get some immunity. So you have antibodies in your blood now, and they're waiting for a coronavirus to have the audacity to come up and try to grab onto one of your cells, punch holes, and deposit its RNA. So it's sitting there on alert. The moment they see anything that even looks like a coronavirus, which could be your second injection, then they attack it aggressively. And that's why the second shot side effects are sometimes worse than the first. Now, if you've had coronavirus in the past, whether you know it or not, you already have antibodies, right? Think about that. So therefore, your first injection is going to be like your second injection, and your second injection is going to be like your third injection in terms of side effects. So the people who really, really, really have bad side effects are those who have already had coronavirus or had one injection before. And that's what makes Johnson & Johnson, to me, a lot more attractive. You only have to go through that once. So take-home messages is, depending upon your age, the younger you are, the more side effects you'll have. The second injection is going to be worse than the first. You want side effects because they are a sign of the vaccine working. But whatever side effects you get, they're going to be gone within 24 hours. I had arm soreness and a headache. I took Tylenol for my headache. Do not take Motrin before, and I like to say 2 to 3 days before, or at 2 to 3 days after your vaccine. Why? Because Motrin or ibuprofen or Aleve, all those are called anti-inflammatory drugs, which means that they decrease any inflammation, which you want if you're treating, remember, itis means inflammation. If you're treating arthritis or inflammation of a joint, or conjunctivitis or inflammation of the eye. So those medications are anti-inflammatory drugs. There also is a good inflammatory component to you creating an immunity to any object that's foreign in your blood. So what you don't want to do is decrease your ability to develop that strong immunity to it. So Tylenol won't do that, but non-steroidal anti-inflammatory drugs like ibuprofen, Motrin, or Aleve, and there are more, they will, naproxen's another commonly used drugs. Those are the main commonly used NSAIDs, or non-steroidal anti-inflammatory drugs. So just keep that in mind. Switch to Tylenol. If you have any side effects, do not take class drugs that fall into the non-steroidal anti-inflammatory drug bucket. All right. These are just my last slides, and I'm excited about Q&A. I know we have special guests, so I'm looking forward to their input as well. But once you're vaccinated, it's important that you still understand that you need to wear a mask in certain situations. Now, the CDC said on Monday and yesterday, and will say again tonight, that if you're completely vaccinated, you can loosen up your mask only if you're in the midst of people who have been completely vaccinated as well. But keep in mind the analogy that we talked about, Mr. Jones and Mrs. Smith, that if you are in a closed environment, someone with corona could have deposited in the air, and then you may be in that small percentage of people, like the 5% and the 90, as opposed to the 95% to get to the 100%. You may be one of those people that don't initially develop that strong immunity, so you can still get the coronavirus. Now, you will never get so sick you need to be hospitalized. You will never die from corona, but you still could take it home. So just kind of keep that in mind. If you decide that everyone around you has been completely vaccinated and you have removed your mask, 6 feet is the minimum, because that's how far in the air it can travel. And then, of course, to the best of your ability, especially when you're in public, try to avoid large crowds. This slide is just to remind you how we get infected by the virus. It comes through your nose or your mouth. Because of that, it has access to your trachea, and that leads to your lungs, and that's how people get in trouble from a pulmonary or lung perspective. These 6 people, I just want to quickly draw your attention to the first 5 who are not properly wearing their masks. The first person didn't cover up her nose. The second person didn't cover up the chin. You must expand superiorly and inferiorly, or up and down, the mask when you're wearing it. And if you don't do that, you'll be like the third person. You have gaps on the side of your mask. Or if you don't lift it all the way up, like the fourth person, you'll have gaps on the side of your nose, and the virus can enter there. And then the fifth person, I don't need to explain that, they're wearing the mask as if it's a turtleneck. Your mask must be multi-layered, and it must be medical grade, in order to efficiently and sufficiently block the virus from entering or having access to your nose or your mouth. I won't talk about that unless it comes up in the Q&A. So at this time, why don't we get to Q&A? I'm going to yield the microphone, I guess, back to Mr. Michelle. I'll stop my slide presentation, and I'm happy to partner with any guests that we may have to address your concerns or answer your questions. Thank you.
Dr. Eadie, thank you very much for well-informed, well-presented information. That I think that we all need to hear this information. That's why we are recording it. With your permission, we are going to find a way to release it to the public, put it on our website, and so forth. So at this point, I'm going to turn to Margot, my executive assistant. She'll read the questions to you as they come in. Margot.
Great. Awesome. Oh, sorry about that, James. Thank you. If I'm going to read a question, and in the meantime, if you do have one, if you could just place it in the Teams chat. But I do have one that was texted from me, to me, sorry. And that is from Andrea Ravitz, our Director of Marketing. If you got first vaccine on day X and were supposed to get the second shot on day Y, but couldn't go or couldn't get in, what happens?
Yeah, so this is anecdotal. This is not a fact. And the reason why I say it's not a fact, but I'm pretty comfortable with my answer, is because we have to follow the science. And I know people out there in powerful positions often just disregard the science, but the science, what they did during the clinical trials, which is everything I've relayed to you today, unless I said it was my opinion, the clinical trials, they made sure for Pfizer and Moderna that they were plus or minus 5 days within the 21st or the 28th day, respectively, right? So you do the math, as long as you get it, the science showed, as long as you get it either 4 days before their 21st or 28th day, or 5 days, after the 21st or 28th day, then the results should be the same. But I'm pretty comfortable saying that if you're delayed by whatever period, you already have some immunity after your first injection. But the key is to get your injection as close to the 21st, if it's Pfizer, or 28th day as possible. And I do know that some healthcare systems, unfortunately, and I'm not spewing any negativity in this conversation, I'm trying to hang out with the pure optimism, but some healthcare systems are not scheduling the appointment for the people after they get their first injection. So at Trinity Health in New England, we made it a priority that if anyone in the audience has received the vaccine from one of our hospitals, before you left, while you're waiting that 15-minute period, they scheduled your second appointment to ensure that you didn't have to go back to 211, you didn't have to go through the VAM system, which is sometimes are not to your satisfaction as an end user. And there's nothing else for you to do but just remember that date and show up. And so we don't do that at Trinity Health New England. I wish other healthcare systems didn't do it, but if it was done to you, you need to then search around the state, unfortunately, find a different location to get your second injection as close to that designated day as possible. Next question.
Thank you. From Barbara Lato, I apologize if I mispronounced the name. How long are the vaccines good for?
Yeah, so that's a great question. I don't know if you guys can still see my slides, but I'm just going to go back to this slide here. I'm going to move that out of the way. But if you see at the bottom of this slide, remember I talked about the flu vaccine being an annual injection. So here's what we do know. People who have had coronavirus before, your antibodies don't last forever. That's why you've probably heard about or read about someone getting coronavirus twice. There's even people out there who got coronavirus 3 times, because although you develop antibodies and immunity to the virus concentration or the number of the antibodies in your blood starts to decrease over time, just like with the flu vaccine. So my guess is that although we do not know yet how long your antibodies will last from the vaccine, we know it doesn't last forever from the actual disease, but from the vaccine, my guess is that we're probably going to find out that unlike measles, mumps, and rubella, which lasts forever, it'll probably look like the flu vaccine, which will just last whatever period of time. And we're going to have to get some booster shots. My guess is that if we have to get a booster shot, my hope is that if we have to get a booster shot, and it's an annual booster shot, that they simply combine the flu vaccine with the coronavirus vaccine and give us one shot for both. And one thing we did see with the flu season in 2020 is that there was no flu. It didn't really exist. So flu just disappeared. It didn't just disappear. We didn't have the ability to spread it because we were social distancing and wearing masks, and some of us got vaccinated. So I'm hoping that if it doesn't last forever, we combine the two, we get one shot, and then we together can wipe out the flu and the coronavirus in future lives. Next question.
Thank you. From James Michelle, how much protection do you have after the first shot?
Great question. So you don't have the amount you have from the second shot. Let me say that. Depending upon the literature that you read, let's look at Pfizer, and they all are going to be about the same. So Pfizer, after your first shot, you've got about 50 to some say as high as 80% immunity to the virus, and you get that second booster, and that's when you get to the 95. So you get the vast majority of it from the first shot, which is why my answer was what it was from the first question. I am comfortable that even if you're super delayed in getting your second shot, you'll still be okay. But to be 100% sure, I'd love for you to find a location and get it on that 21st or 28th day, depending upon whether or not you have Pfizer or Moderna, respectively. Next question.
Thank you. From Edith Lordy, will we ever be able to go back to our normal life, meaning no social distancing?
So first of all, let me give you my opinion. I don't think things are going to ever be the way they used to be pre-pandemic, which is not necessarily a bad thing, right? So virtual care is a prime example. We do more business through virtual care at Trinity Health New England than we did in actual face-to-face, right? So some people, unless you're you need to see a provider and they need to physically do an exam on you, you can do most of your visitation, your annual physical, most of it virtually. You can just sit in front of your computer like you're doing today and interact with the doctor. And unless you have some specific illnesses, and there's technology right now that they can take your blood pressure, as you know, you can get your temperature, you can get your heart rate, the stuff that they have to do when you go to the office, they can now do all that at a distance. So we call that telehealth, And then virtual care is everything. They can do a lot more. They can do a consult for you. They can refill your medications. They can watch you walk. And what's special about it is they can look in your environment. They can say, hey, why don't you take me to your refrigerator? Or let me see around your environment to see if there are any tripping hazards, or they can look at the diet that you're eating. So we are much smarter physicians with virtual care. So, visit our website if you're interested in learning more about that. But let me answer the question. It's when we reach herd immunity. Herd immunity, when Dr. Fauci says the United States of America has reached herd immunity, we can all do jumping jacks, high five each other, remove our masks, and go back to whatever the new normal is going to be. But until then, we've got to be very cautious. And remember, herd immunity equals about 80% of us being vaccinated in the United States of America. Next question.
Thank you. Another question from Andrea via text. In your elevator example, how long does the virus live in the air before it dies?
Yeah, that's a great question. So it's a hard answer to, it's a hard question to answer, but let's suffice it to say about 24 hours, right? So that's pretty scary. Now it could be sooner depending upon the ventilation, right? If there's air or heat pushing from the ceiling down, that will push it down. Gravity is 9.8 meters per second square. But if there's ventilation at the bottom pushing up, then it may hang out in the air much longer until it shuts off and then it falls to the ground. But I like to use a rule of about 24 hours. Remember early on in the pandemic, we were wiping every single thing down. My presentations, I may have given to some of you, I had a slide on whether it's metal or plastic like your keyboard or your steering wheel. The studies showed us different lengths of time by which the virus lived on that surface. But because we know it really infects us when it's in the air, we're less, not that we shouldn't be totally, we're just less concerned about wiping down our keyboards. I would see people wiping down everything in public, and there was hand sanitizer everywhere you went. You don't see that anymore because we know more about the science, and we know it's when it's in the air and it has access to your nose and your mouth, hence the importance of a mask, is when it infects you or when it has access to one of your cells. I want to say it again, that the spike protein or the hand and arm grabs onto your cells, punches holes, and deposits the entire RNA into your cell. And so that it uses your cell, it hijacks your cells to produce more coronaviruses inside of your body. Next question.
Thank you. From Senator Moore. Welcome, Senator. After getting the Moderna, surveys are coming in offering a consumer award offer to complete the survey. Is that authentic?
I don't know about the survey enough. Are you Senator? First of all, hello, Senator, and thank you very much for participating. It's always special when we have people who make the laws and enforce the laws to participate in this conversation, and because we depend on you so much to make the right decisions on our behalf. So thank you for participating. Now, I am not sure exactly of the survey that you're asking about. I do know of a survey which may not be that one, but once you're vaccinated, and we put you into the VAMS system, and then we send it to the CDC. The CDC then sends you a text message or an email like every couple of days between your first and shortly to sometime after your second injection to see how you're doing. And that's how it gathers information. They want to know, do you have any fevers, chills, headache, cough? Have you missed work? So those basic questions, they just dump into the database. And that's how we learn more about the impact that the vaccine has on humans in America. If that's what you're talking about, absolutely, that's authentic. And I encourage people to participate in that study. It's not a clinical trial, but you're simply sharing information across our country to the Centers of Disease Control and Prevention so that it can be more intelligent. They send that information out. People like me get the information, study the information, interpret it, and memorize it so that I can share it with you, the community in this great state of Connecticut. Next question.
Thank you. Another question from Andrea. As a pro-vaccine parent, I would like to know how much testing are these organizations doing on kids to feel confident this will be okay for them?
Great question. So I love that question because we cannot forget about the kids. Now, let me take a step back. Back during I consider us having 2 surges, and I base it on deaths only because I'm a physician. Some say 3, and they base it on the infections. Infections aren't as much of a concern to me except the spreading, but it's the deaths that we want to mitigate as quickly as possible. And so Pfizer asked for approval from 16 and above. Moderna and Johnson & Johnson asked for approval for 18 and above. Remember, the other ones got 100% approval. Pfizer only got 80% approval, and that's because four of the people on the panel to approve it were actually pediatricians. And because they didn't have enough kids between the ages of 16 and 18 enrolled in their clinical trials, they said, why don't we just do 18? So they voted no, and let's come back and bring the kids in later, including 17 and below. So let me answer your question. So all of them had already started bringing in kids of all ages, and you may Google, 60 Minutes or some of these news stations, and you'll see they actually interviewed kids and their parents who are in the clinical trials now. So I've seen 7-year-olds, I've seen young teenagers and things of that nature. So the kids are already there. The reason why they waited for the kids is because kids weren't dying at the rate that, remember, 95% of the deaths in this state were 55 and older, right? And we just haven't seen kids. There've been some, and maybe in the New York area, maybe some that got very sick down in the southern part of the state, and I'm not sure how they did, but it's not been a problem, so to speak. But now kids are getting sicker and sicker. If you've heard of the disease called Kawasaki's disease, kids who get coronavirus are presenting like they have Kawasaki's disease, which is a very bad disease, and they can get very sick and not do well. So my guess is, and I'm hoping, and remember the president said by the end of May, remember in Connecticut, we opened up on May 3rd for everyone who was eligible. It doesn't necessarily include kids, but he said by the end of May, and I'm assuming he's including kids, we will have enough vaccines for all Americans. So that means to me that he's already having conversations with the Pfizers, the Modernas, the Johnson & Johnson, AstraZeneca, saying you need to hurry up, get enough kids in your clinical trials, and ask for the FDA to approve your vaccine for all ages so that we can vaccinate our kids as well. And that's how we stomp out this disease. So I'm thinking it's going to come within the next few months. I'm hoping and praying that it comes in the next few months. And listen, to the extent you had kids, I would encourage you to strongly consider, I'm not asking you to do it, but I'm hoping the conversation enriches you to a comfort level that you include your kids in the vaccination lines when their eligibility comes up. Thank you. Next question.
Thank you. Before I return to the questions, I would like to share a comment from Jay Williams, president of the Hartford Foundation for Public Giving. Outstanding presentation and eager to partner with you and Trinity Health to get information and vaccinations into our underserved community.
Listen, Jay is a great guy. We have a lot in common. We're fraternity brothers. We also came to the state of Connecticut right around the same time. And I also know we both love the state of Connecticut and are glad we're here. So thank you for your leadership. I look forward to partnering with you. I bug your teammates all the time. Hopefully they don't complain to you, but I do look forward to partnering with you. Your organization does amazing things for the Hartford and greater Hartford area. And this is, I can't think of anything more important in the work that both of our organizations do, but to get us through this pandemic safely and quickly. So thank you, Jay, for the kind words. And again, I look forward to partnering with you.
Thank you. And we have a question from Kelly Kennedy. Can you explain the vaccination registration process? It seems like there are several different approaches to registering and for finding vaccine appointments.
Yeah, you're absolutely right. And I know we have at least one legislator on the line, the senator. So, and this is and I know this because I'm always asked, and they come ask my opinion because they want to make sure that their constituents have access. This is that access, not hesitancy. This is access again. So listen, we have heard, and I commend the 211. We're learning. I like to say we're building the bridge as we cross it. So we're learning every day. The feedback that we get is that sometimes 211 is complicated to navigate. Even more complicated sometimes is the VAM system that we have here in Connecticut. And then there are healthcare systems that have created sort of a third party way to register, if you will. So all of them are doing that. So whatever is easiest for you. Now, we also realize that we have the responsibility to partner like organizations like Mr. J's organization, the Hartford Foundation for Public Giving, and to partner with them to ensure that we not only take the vaccine to the community, but we listen to, partner with, and make it easy for the community, especially those high vulnerable communities, to get access to registering, because we've got to get you registered, because we've got to let the CDC know that you have received the vaccine so that you can answer those survey questions. But we have to figure out by asking you, what's the easiest way? And one thing we know that we're going to be doing, and that we're all doing, I think, is we're providing registration for you. There are also pop-up clinics where you don't have to be registered. You can just get in line as early as possible, to the extent that they have enough vaccine. So the rate limiting factor is going to be the supply of the vaccine. And we do all the registration for you. Now, that is not the best experience either, unfortunately, because it takes so long to register people. People are in line for these pop-up clinics for hours, and it goes back to the way it used to look with testing. So we're getting smarter and smarter every day. We're partnering with more great organizations to make it easier for you. And I think I'm sure I comfortably speak for all the healthcare systems in the state of Connecticut. We've got some exciting things coming up very soon to make it much easier for you if you've not been vaccinated yet. So that's our job. That's our responsibility. As a Catholic healthcare system, that's our mission. Next question. You can visit our website, or just, I'm every night we're having these conversations. So as things finalize, I will be announcing those. And I also have to match it with the availability of the vaccine. So I would love to announce some things already, but I'm in conversation with the DPH, begging for more vaccine so that we can make it easy for you to get registered and get vaccinated on the 21st or the 28th day, and not have any hang-ups, and make it as seamless as possible for you and your family. I'm just excited that so many people want to get vaccinated. That shame on us if we don't figure out a way, as leaders in the state of Connecticut, this great state of Connecticut with great leadership. Shame on us if we don't stop what we're doing and make sure that we make it easier for the remainder of the people in the state to get vaccinated. And we owe that, and it benefits not only you, but it benefits us all as a state, because we will continue to be recognized as one of the states that have a best practice from the vaccination initiative. I think we were ranked number 3 or number 4 the last I checked. I like to be number 1, and I think some of the things that we all have planned will get us to the number one position. Not that I'm trying to compete with other states, but those high rankings equal lives being saved. And so I am so proud to be a part of a team here in Connecticut who is committed to making it easy for the residents to get vaccinated. It's the only way we're going to get through this pandemic safely and in a timely manner. Sorry, I'm being a little tangential.
Thank you. I'm going to move to Daryl Jones's question. What do you say to the young folks who are hesitant on taking the vaccine because of the past practices that was negative toward people of color? What is the difference now?
So the first thing I do is I recognize that, Henrietta Lacks, the Tuskegee experiment with syphilis and the lack of treatment by promising people free healthcare when healthcare wasn't available to those communities of color in Alabama at the time. So free healthcare was very attractive, but they were deceived, and they were exposed to a very bad disease and were never treated, although penicillin was in existence. I acknowledge all of that, and I acknowledge it comfortably and with security that it was a misbehavior of the United States of America. But then I transitioned to today in reality, and that is a couple of things. One, for the younger generation who is not super excited about getting vaccinated, I offer them about an hour of conversation. And what I do is in a different manner, because depending upon the audience, my level of science varies, right? So hopefully this was not very scientific, because I imagine that there were not a lot of scientists in the audience, and I hope I satisfied your expectations. But teenagers and millennials and so forth, they're different. So we need to figure out a way to get to them, oftentimes through social media. We need to meet them where they are. We have the obligation to go to them to satisfy their space, and then that maybe they will give ear to us. But sometimes I get a little cynical and I say things like this. I say, what did you eat yesterday? And someone's going to respond with whatever they ate. And I say, so what farm did that animal come from? Let's say it was a piece of beef. What farm did that animal come from? And who was the farmer? And did they skip any steps to get FDA approval? And how healthy was the animal on the farm? And how was it treated? Because we know if you stress out any animal, just like a human, your body is going to produce certain chemicals that's going to put you in an unhealthy state for as long as you're stressed out, right? And so that translates into what we eat when we eat it, and those chemicals to some degree are still active. So I began to ask about the water that they drink, and then people who, do whatever they do that's not that healthy, I challenge them on that. And I say, there's an inherent amount of trust that you have when you go to a restaurant. Although you know nothing about the chef oftentimes, you know nothing about the food you're being served, but you inherently trust them to some degree. And so I ask people to consider the alternative, right? We know if you do absolutely nothing, like not get vaccinated, we can guarantee an outcome. We can guarantee that you are either going to get infected and infect someone else, and then they infect someone else and they infect someone else. And some of those people through that whole chain of infection are not going to do well, and they're going to die. And so when we have that conversation about you already trust, listen, I take a blood pressure medication every single morning. In fact, my doctor, because I'm a physician, we negotiated what blood pressure medication was best for me. So I participated in it. But now if someone in the audience asks me a question to name the blood pressure medication, I will get that right. If you ask me to name the milligrams, I'm going to have to think about it for a second. And then if you ask me to give a 5-minute, not let alone a 50-minute like we just did, a 5-minute presentation on the blood pressure medication that this doctor takes every single day, I couldn't do it because I don't know enough about it. These vaccines, this is the most transparent this country has ever been for 1, 2, and 3 medications. We've never known as Americans so much about a particular. People should be experts to some degree if they listen and I relay the information correctly, such that you can give the presentation. We know a lot about this. There is no hanky-panky. There is no hiding. And I will end my conversation with the teenager by reminding them that there were people of color, women of color, who led the production of the vaccines in all 3 of those companies. And so I don't know what else to tell a person other than the option is to do nothing and watch what happens. And we know what happens because it happens thousands of times a day in this country. But we can sit down, have a conversation. You can make me convince you that this is not a bad thing. And as a Christian, I happen to think that this is a gift from God, this vaccine, because this is the answer to get us out of the mess that we've been suffering in, tomorrow marking the 1-year anniversary. So those are the kind of conversations. They're not easy. I'm super passionate. I get emotional at times, and it may be perceived as being overly aggressive. So I've got to be sensitive to that. But it means so much to me for all age groups to not only understand science and healthcare, because when you don't, you depend on other people, and other people don't always have your best interest in mind, right? But to the extent where we can all make sure that we all have a complete understanding about the healthcare decisions that you are asked to make, when oftentimes you're not armed with the right knowledge, we sometimes make bad mistakes. And I want to eliminate that in the state of Connecticut. I want everybody to understand everything they want to understand about healthcare so that we can all live the longer and healthier lives that our God has intended for us to live. And I think it starts at the teenagers because they're going to be the decision makers of tomorrow. We don't have problems when people are in their 40s and above. It's when we go down to the 30s and the 20s and the teens that we have to work a little extra hard to convince them. But listen, it's our job. And as difficult as they may make it for us, we were once at that age before, and we made it hard for people in their 50s like me as well. And I'm excited about the challenge and making sure that kids across our state can give a presentation in one of their classes about how the virus works and how the vaccine works and how proud they are that their entire family, at least 80% of them, got vaccinated when they were eligible in the state of Connecticut. I'm being tangential and emotional. I appreciate it, but that's the answer that I would have for the Mr. Jones who asked the question.
Thank you. From Tony Crow, our COO, how much advance notice does Connecticut receive regarding vaccine deliveries?
Yeah, that's a problem. The rate limiting factor as to how many people we can plan to vaccinate, sometimes we don't know until it's showing up in our state. Now, the DPH, to my understanding, may get an email, a day or two. We usually get our shipments around the first couple of days of the week. And then we have no idea. We have an idea, but we cannot say with certainty how much we'll even get the following week. For whatever reason, that's just the way things are working out. So it's very difficult for us to plan accordingly. We like to plan specifically within Trinity of New England, but we don't know how much the state's going to get. We also don't know how much we're going to get. So that's what complicates things. And that's why, I did a talk last night and someone said, you guys are doing these pop-ups, but you don't even give us an advance notice. so that we can take off work or plan accordingly. Now, my response, although it wasn't a good one, to be honest, it was because sometimes we don't know. If we get extra trays of a vaccine and we're expected to get them in the arms of citizens within a week, I mean, they expect us to use them all up in a week, which I don't blame the governor. I would expect us to do the same thing, and we're being held accountable by the governor. So one way to do that is to just open up a pop-up, for example, and get people vaccinated as quickly as possible. And unfortunately, we can't always give you a long notice. So again, we're working through that. The president has promised us even more and more in terms of the allocation. And when we get a larger number of vaccines coming to the state of Connecticut, we can more properly ensure that we can take our time and walk you through it, answer your questions, address your concerns, and help you plan accordingly so that you can get in line and get vaccinated as seamlessly as possible.
Dr. Eadie, we have one more question, one final question, as we've been notified that we have 5 minutes left for this meeting.
Okay.
Okay. Thank you.
And just for the record, I could go on for 3 and 4 hours because this.
Well, I think, Margot, do we have a time limit on this?
Cole, I believe he can confirm that we don't.
Okay.
We do not. Thank you.
I will keep going.
All right.
Yeah,
Awesome.
I don't. If it's okay with you, look, this is you're the CEO.
No, absolutely. No. Let's keep going until all the questions are asked, if you are willing.
Well, let's bargain. Let's go an extra 10 minutes. How's that?
Okay, that works.
Listen, if this is going to make a difference in the lives of people in your audience, shame on us if we don't go extra time or overtime to ensure that we arm people with the knowledge. Otherwise, they may never ever get it, right?
Absolutely.
Thank you.
Thank you much, Margot.
Awesome. Thank you. Representative Hilda Santiago has a question. She would like to know the after effects like brain fog, pulmonary effects, and anxiety issues. Is there anyone looking at the after effects in our state, and where can someone volunteer?
So thank you, Representative, and I think we participated in at least one conversation before. So I'm not sure if the representative is talking about long-term effects from the virus or from the vaccine. So let me just address both of them. So I'm a 60 Minutes fan. I look forward to Sundays and watching 60 Minutes. And about 4 or 5 weeks ago, so you can Google if you're interested in checking it out, they did a piece on so-called long haulers. And these long haulers, which you probably have heard about before, Senator, which is another reason why I couldn't wait to get vaccinated. These so-called long haulers are people who have had COVID-19 and lived through it. Now they have these chronic and probably for the rest of their lives, sequelae, what we call sequelae or long-term impact from having the virus. And it stems from problems in the brain to problems in the spinal cord and the problems throughout your entire body, your lungs, your fingers, your legs, etc. People are having seizures. People are having chronic fatigue. People are having numbness and tingling. People are having chronic breathing problems. I mean, and these people are depressed, and they some of them are saying, I'd much rather not live than to have to bear this uncomfortable state for the remainder of my life. And so, so we all got together in the state of Connecticut as healthcare providers, and we have clinics now for those so-called long haulers. And that is just, that is something that I would hope none of us have to go through. And we can prevent that from happening by complying with the CDC recommendations around masking and social distancing, and certainly preventing ourselves from getting infected by getting vaccinated. So that's that. Now, when it comes to the vaccine, there have been no signs of long-term sequelae. Now, here's what I'll say. So remember, these clinical trials started way back at the beginning of the beginning of last year. They immediately shifted, started working on vaccines, and enrolled people into their clinical trials and injected them with the vaccines. So we're just lagging just a couple of months behind when the pandemic first hit in the state of Connecticut on March 8th, if I remember correctly. That was our first confirmed case. So we know just as much as almost as much from the vaccine as we do from the virus. And there's no evidence of any long-term side effects or sequelae, we call it in medicine, from the vaccine. Now listen, I am not God. I cannot forecast with a crystal ball the future. So I don't know what tomorrow is going to look like. But today, There's no evidence of any long-term sequelae. Usually we see within months any long-term side effects from a vaccine, and many of us have been vaccinated for over a month at this point. So I'm confident that if we do see something, it's not going to be to the extent that we see in the long haulers from this virus. Thank you, Representative.
Thank you. From Barbara Lato, when do you think we will have 80% herd immunity?
Wow, that's another great question. So I think if the mutation, so I kind of look at, I try to come up with simple analogy. So it's me, not you, as to why I try to make things simple. So I look at things being a race between two opponents. One opponent is people in America or on the planet who have access to the vaccine. And so in order to get herd immunity, we have to get about 80% of us vaccinated. And really, again, the rate limiting factor is the number of vaccines. In this country, the president has said that we will have enough vaccine for everybody by May. So that's one person who's trying to cross the finish line and win. The other person is the virus. The virus has a goal, in this analogy, in my mind, of creating a mutation of itself whereby you don't have protection from the vaccine. And to the extent where the virus wins the race, that means we have no end in sight. And I'm hyperbolizing, I'm exaggerating, but that means we have no end in sight as to when we're going to reach herd immunity if the virus wins. So either the virus is going to continuously mutate because it knows there's a vaccine out there, because it's trying to infect people like me who have an immunity, and it's saying, oh, I can't attach to its cells, punch holes, and deposit RNA. So let me switch up a little bit. And that's why you hear scientists say that the UK and especially the South African variant has a higher degree of spreadability. And what they mean by that is the mutations are in the arm and the hand. The mutations are in the spike protein. And so it can literally grab onto your cells faster, harder, and more quickly punch holes and deposit RNA. So that's why Dr. Fauci says these variants are nasty variants, because they can jump from person to person and spread much faster than the original coronavirus. So when you factor in the mutations in the equation, I don't know. If there were no I don't know, but I can guess based on what the president said that we should, by the fall, we can theoretically reach herd immunity as a country without a problem, and I'm sure that applies to the globe. Connecticut can do it sooner because we are going to open it up much faster than the rest of the states, the general population, on May the 3rd. Now, if we didn't have the mutations in existence, then we can do that in a much shorter period of time. And that's why I came up with the fall. And we can even do it sooner than that as a country, depending upon the amount of vaccine available. To the extent where the virus crosses the finish line before we reach 80%, then we may be starting this thing all over. So I may need to get yet a third injection that has considered the whatever mutations are in existence. And that's going to be a booster, if you will. But then we have to produce all of those. We have to start back over through VAMS and 211 or whatever the case may be, get back in line, do more pop-ups to give that extra injection if human beings don't beat the virus in the race to cross the finish line of reaching herd immunity at about 80%. So I know that's a lot. I hope that answers your question. But we're in a race against this virus, and time is the factor here. And we need to, as quickly as possible, if this vaccine is for you, we need everyone participating in today's call to have a conversation with someone who's sort of on the fence or saying that they don't want the vaccine, and just remind them that we all have God's given responsibility to do our part to make this place a better place and a safer place so we can live the longer and healthier lives that I believe God has intended for us to live. Next question.
Sorry about that. Yes, from Deb Eastman, are the studies showing it's safe for pregnant women to get vaccinated? And is it possible for women to transfer COVID to their unborn child?
Yeah, so that's a great question. So I'm going to answer the question sort of personal, not to me, but from one of our physicians, because I think she is very unique. I'm not going to say her name, but she has said her name. You have probably seen her on television. She works at Trinity of New England. She works specifically at St. Francis. And so she is an infectious disease and prevention expert. She obviously is female. She's of reproductive age, and she's pregnant. And she received both vaccines. And she just found out that she was pregnant, maybe between her first and second shot, right? So if you listen to that scenario, which is a real life scenario, and I almost wish I didn't get permission to give her name, but for women out there, maybe we need to have a conversation for women who are pregnant or considering getting pregnant in the near future, for all of them in the state of Connecticut, and let her do the speaking. So if anyone's interested in that, you want to arrange it, just let me know. I'll get the speaker and you get the audience. But this is a woman who's probably so unique because she is probably the only expert of her kind in the country who got pregnant around the vaccination time, who's on the front lines, has received both her vaccinations, and has a healthy pregnancy. So I tell her, you need to be on CNN, you need to be on MSNBC, you need to be on Fox News, you need to be everywhere so that this country and the world can see you. And the level of confidence, because I didn't convince her to do it. She did her own research and she went public and said, I'm going to get vaccinated. And she clearly follows her baby very closely. You've got to have an OBGYN who you trust, who at least knows the science or partners with someone like her who knows the science. And she, I think, is the poster child or the poster woman or the poster professional, I think, for this entire planet, because there's not too many people who fit that description that I just described. She's a brilliant lady, and she can talk about why she decided to get vaccinated, get pregnant and get vaccinated in the midst of a pandemic, in the face of a vaccine. And remember, there were no pregnant women enrolled in the study. Now, there probably are a number of pregnant women now enrolled in the study, but she did it. She enrolled herself into her own study, if you will. And every time I see her, how are you and how's the baby? And her reports are always, we're both just fine. So I think that the answer to your question is you have to make that personal decision yourself. There are people like her who we have access to, who may be able to do a large consultation for a number of you who are interested in listening to the conversation, but she's doing just fine, and she will speak on behalf of moving forward with someone who's in her situation, thinking about getting pregnant or recently diagnosed with pregnancy, and who's wondering if they should get vaccinated or not. I hope that settles the any concern or answers the question that you posed.
Thank you. We have a question from Cole Mercier. What is the best method to find one of the pop-up vaccination clinics?
You know, the DPH website, I'm sorry, I should say probably the ct.gov website, which has a link to the DPH, and they share all that information. They gather the information on a regular basis. Commissioner Gifford does a phenomenal job in making sure that she communicates out and her team communicates out to the residents in the state of Connecticut. Now, so that's my recommendation. I will tell you though that, you know, once you find out, you need to get there early, because every pop-up clinic that we participated in, except maybe for the teachers at the Hartford public school system, they have been long lines, and they have been longer waits than you would want. And they sort of remind me of how testing lines used to be back when the state first started to test. So not a good solution, not a perfect solution right now, but again, you'll be hearing more about what different healthcare systems are doing, like Trinity of New England, to make it easier for you and your family, in the form of a pop-up or not, to be more seamless for you to get registered, even while we create the third-party registration and have to do the extra work to put it up in VAM. So more to come. Stay attentive. Keep watching the news and keep checking the state's website. And then, you know, always have a person in the healthcare space, to the extent where you can, who can sort of be your voice box and ambassador on behalf of you and your family if you're not in healthcare, because they always get that information first. They can guide you and help you navigate through the healthcare system, which in America is extremely complex. Next question.
Thank you. From Kelly Kennedy, what do you advise for mask wearing outdoors when you can stay at least 6 feet apart?
Wear the mask. I can't stress that. In public, you wear your mask. The CDC has not relieved people of wearing a mask in public. I can't explain what's happening in cities like Boise, Iowa. I have no idea why they would, you know, celebrate. This is my personal opinion. Why they would and I don't mean to offend anyone, why they would celebrate have a mask burning ceremony. I just don't understand that. People are still dying in the thousands every single day, and the mask is more effective than the vaccines will ever be. And so you need to mask up. If you're going to take your mask off, you just make sure that everyone in the closed environment has been vaccinated, and you've got to be comfortable that the air has not been polluted, like the analogy I gave by someone who has corona. How you figure that out, I don't know, unless it's in your own personal homes. And outside, although you have God's ventilation and it's not a closed environment, so it's much healthier, I would recommend that you still mask, because if you're taking a walk with your significant other through a park or a neighborhood, and there's other people on the walking trail, for example, and they're not wearing their mask, they could be depositing in the air that you walk right into the virus. And so out in public, I'd suggest that you always wear a mask.
Thank you. And we have a final question from Franco Barrero. Been working out with a mask for a long period of time now. Is the heavy breathing under the mask good for the lungs? And can this cause damage to lungs down the road?
There's no reason. I've been asked that question. It's been a while since I've been asked that question, but I've researched, and I've asked experts as well. There's no reason to believe that you will have a negative impact. Masking while exercise will have a negative impact on your lungs. No, not at all. Now, I would recommend, though, that you consider, depending upon the risk in that environment, not wearing an N95, but instead wearing a medical grade mask, like the surgical mask, like the light blue masks, or something that we know that is really going to filter effectively the virus. But listen, when you're at a gym and you're on a treadmill and you're next to someone who's not wearing a mask, because they're working out, that virus, if they have it, that they release into the air, is not going to go just 6 feet. It's going to go probably up to 20 feet, the literature says. That's equivalent to singing or breathing very hard or yelling. And so that's a higher risk environment if you're in a place like a gym. So just consider that, please. But now if you go to a gym and it's hours since number of people have been there, that lowers your risk, but there could still be some virus in the air. And then the filtration systems have to be ideal. So whatever gym you go to, I am not trying to, unfortunately position the owners of the gym, but you just need to know about the filtration system, right? Airplanes changed their filtration system once the pandemic started so that it captures the virus. They didn't have that prior to the pandemic because they didn't need to. But even on an airplane, if you think about it, before the virus interacts with the filtration system, just like your mask, it's floating in the air, looking for cells that it can grab onto, punch holes in, and deposit its RNA into. So thank you guys very, very much. Thank you for allowing me the extra 10 minutes. My prayer is that this helped. If it didn't, I apologize. Please forgive me. To the extent where we need to have more conversations and everyone has a very busy schedule, we will make sure that we make ourselves available to ensure that you, your friends, and your family have the information they all need to make the right decision to help us transition out of this pandemic. God bless you all, and thank you, Mr. Michelle and Access Health.
Dr. Eadie, thank you very much for your expertise and for your willingness to share your knowledge and hopefully help to save some lives. We look forward to further collaborations with you. As you know, we've just completed a health disparities study. We're going to be looking for partners like yourself and Jay Williams' organization to help those who are in most need. Thank you very much. Appreciate, on behalf of Access Health and all the folks who participated, thank you very much.
Pleasure.
Thank you. Thank you. Have a good evening, everyone.
Good night, everybody. Thank you.
Thank you.
Thank you. Bye-bye.